Uterine fibroids, also known as fibromyomas, are benign tumors that develop from the uterine muscle. They are the most common gynecological condition in women of reproductive age, being hormone-dependent. They tend to regress spontaneously after menopause due to the decline in female hormone levels. Fibroids are often multiple, in which case the uterus is referred as polymyomatis. There are three types of fibroids, classified by their location: intramural, located within the muscular wall of the uterus; submucosal, located just beneath the uterine lining, often causing heavy menstrual bleeding; and finally subserosal, located just beneath the outer layer of the uterus. It can be either sessile, meaning fixed, or pedunculated, meaning attached by a stalk. Fibroids themselves do not bleed, but rather endometrial hyperplasia leads to an increased menstrual flow. Bleeding can also occur mechanically due to endometrial abrasion caused by intracavitary fibroid, meaning a fibroid within the uterine cavity. The diagnosis of fibroids rely mainly on pelvic ultrasound, which helps determine their size, location, and the impact on surrounding organs. Fibroids can lead to various complications. One of the most common is hemorrhagia, especially with submucosal fibroids. These can cause heavy and prolonged menstrual bleeding, potentially leading to iron deficiency anemia. Another complication: infections. Fibroids, especially those located in the uterine cavity, can cause an infectious syndrome that manifests as leukorrhea or an abnormal vaginal discharge. This complication is more common if the fibroid is intracavitary and has been expelled through the uterine cervix. Another serious complication is aseptic necropiosis. It occurs when there is a poor vascularization of the fibroid, particularly in the case of pregnancy or immediately after childbirth, leading to the ischemia of the fibroid. This can provoke an acute infraction of the fibroid. These complications present with a clinical picture of fever ranging from 38 to 39 Celsius, and an intense paroxysmal pain, tenderness on palpation, and an increase in fibroid volume. On ultrasound, the fibroid appears heterogeneous with a target-like pattern. Analgesics and non-steroid anti-inflammatory drugs helps relieve the pain, but in cases of pregnancy, antipyretics and prophylactic antibiotics are used without non-steroid anti-inflammatory drugs. Corticosteroids may be administered if the pregnancy is less than 34 weeks due to the risk of preterm labor. It is important to rule out any pelvic inflammatory infection before jumping into the diagnosis of this complication, as it could also contribute to the symptom. Another very important complication, which are mechanical complications. Fibroids can also cause various mechanical complications depending on their location and size. Fibroids embedded in broad ligament can exert pressure on the ureters, causing ureterohydronephrosis, meaning the dilation of the ureters due to an obstruction, or more rarely on the iliac veins, potentially leading to thrombophlebitis. Fibroids located in the space between the uterus and rectum can compress the rectum, leading to constipation. And finally, fibroids with anterior development, meaning toward the front of the uterus, can press on the bladder, causing polyuria, meaning frequent urination, and dysuria, which is a painful or difficult urination. Continuing with complications, a torsion of a pedunculated subserosal fibroid. A pedunculated fibroid, meaning attached to the uterus by a stalk, can twist on itself, leading to torsion, which may cause intra-abdominal hemorrhagia. This presents as acute severe abdominal pain accompanied by abdominal guarding, which is a rigidity of the abdominal muscles, and sometimes vomiting or loss of consciousness. This is a very serious surgical emergency requiring immediate intervention. Another complication: incarceration. Although rare, fibroids incarceration occurs when fibroids grow into the sacral concavity, a space at the back of the pelvis. These can cause significant pain and symptoms of rectal or bladder compression, leading to difficulties in defecation or urination. And finally, fibroids can cause fertility issues, particularly when they disturb the uterine cavity or interfere with embryo implantation. Although not a direct cause, fibroids can make implantation more difficult. Fibroids can increase in size during pregnancy, which may cause pain and medical complications, including necrobiosis. Pregnancy complications due to the uterine fibroids are rare, but the risk increases when fibroids are located in the lower segment of the uterus. Among the potential risks are miscarriage and preterm birth, as fibroids can disturb fetal growth or trigger premature contractions. They can also interfere with the baby's position during delivery, leading to malpresentation, where the baby is not positioned correctly for a vaginal birth, such as in a breech or a transverse position. A fibroid can also lead to placenta previa, which is a condition where the placenta partially or completely covers the cervix, blocking the baby passage and increasing the risk of severe hemorrhagia. Additionally, fibroids increase the risk of postpartum hemorrhagia, as they can prevent the uterus from contracting properly, resulting in excessive bleeding. We will talk about clinical science and treatment of this condition in the next video. I hope this information were helpful to you, and if you have any questions, please leave them below. Thank you so much for watching till the end, and I'll see you in the next one.